It starts so innocently. Doesn't it? Just a new spot, a little bump you hadn't noticed before. Maybe you think, oh, it's just another age spot. Or, I must have bumped myself there. We've all done it. We've dismissed those little changes on our skin, sometimes for weeks, months, or even years. But what if that seemingly harmless mark isn't just a sign of time passing? What if it's your body trying to tell you something far more serious, whispering about a silent threat that many of us simply overlook? The painful reality is that skin cancer, especially in its early stages, often hides in plain sight, mimicking common, benign skin conditions. It's a stealthy adversary, and by the time it becomes painful or noticeable, it might have progressed further than we'd like. The secret isn't about being alarmist, but about being informed, about understanding the subtle language our skin speaks. Imagine having the knowledge to spot a potential issue early, giving you the power to act quickly and potentially save your life. It's not about fear, but about empowerment. In this video, we're going to uncover the often missed signs on your skin that could signal a silent cancer. We'll explore exactly what to look for, not just what a suspicious mole looks like, but other, less obvious indicators that are just as crucial. These are the things doctors hope you already know, but often don't get talked about enough. Understanding these could make all the difference. Watch to the end for something that will truly surprise you. Something about protecting your skin that you might not have considered. Let's begin by shining a light on the first, and perhaps most talked about, silent sign: changes in existing moles or the appearance of new ones. Now, many of us have moles. Some we've had our whole lives. Some that pop up as we get older. Most of them are perfectly harmless, just a collection of pigment cells. But when a mole starts to change, that's when it demands your attention. Think of it like this. Your moles are usually quite predictable. They have a certain shape, a certain color. They stay put. When one decides to break ranks, it's a red flag. We often talk about the ABCDEs of melanoma. And for good reason, because they are incredibly helpful. Let's break down those ABCDEs, not as a checklist to panic over, but as a friendly guide to help you observe your own skin. The A stands for asymmetry. If you drew a line right down the middle of a suspicious mole, would the two halves match? A harmless mole is usually symmetrical. Both sides look the same. But a mole that's asymmetrical, where one half looks different from the other, warrants a closer look. Imagine a perfect circle or oval that's symmetrical. Now imagine trying to cut out a shape from paper, and one side is jagged while the other is smooth. That's asymmetry in action. It's subtle. It's not always obvious, but it's a key indicator. You might find yourself tilting your head, trying to make the two halves align, and if they just don't, that's your cue. Then there's the B, for border. Harmless moles tend to have smooth, even borders, a clear edge where the mole stops and your skin begins. Think of a neatly drawn circle. But cancerous moles, particularly melanomas, often have irregular, notched, scalloped, or poorly defined borders. It's not a crisp line. It might look blurred, or like it's spreading into the surrounding skin unevenly, almost like an ink blot. It might be hard to tell where the mole truly ends. This isn't about being perfectly precise with your measurements, but about noticing a lack of neatness. If the edge seems fuzzy or ragged instead of smooth and distinct, pay attention. It's an important clue, suggesting that the cells might be growing in an uncontrolled way, reaching out in an irregular pattern. The C is for color. This one can be tricky because moles come in all sorts of colors, from light tan to dark brown, even black or blue. The key here is not just one color, but multiple colors or an uneven distribution of color within a single mole. A suspicious mole might have shades of brown, tan, black, and even red, white, or blue mixed together. Sometimes, a mole might start out one color and then develop darker or lighter patches within it. Think of a painting where colors are blended together smoothly versus one where distinct, mismatched colors are thrown onto the canvas without blending. Any sudden darkening, or the appearance of a new color within an existing mole, is a significant warning sign. It suggests an inconsistent growth of pigment cells. Next up is D. For diameter. Melanomas are typically larger than 6 millimeters, which is about the size of a pencil eraser. Now, this doesn't mean every mole larger than a pencil eraser is cancerous, but it's a general guideline. Many benign moles can be larger. The point here is more about change in size. If a mole is growing, especially rapidly, that's a concern, regardless of its initial size. So, if you notice a mole that's been steadily increasing in size, even if it started small, that's just as important as if it's already large. It's the growth, the dynamic change. That is the most crucial part of this D. Getting into the habit of measuring or taking a picture with a ruler next to it can be helpful if you're monitoring something. And finally, the E for evolving. This is arguably the most important of all the ABCDEs. Evolving means any change in a mole, whether it's in its size, shape, color, or elevation. It could also mean new symptoms developing within the mole, like itching, tenderness, bleeding, or crusting. If a mole that was once flat now feels raised, or one that was perfectly still now itches all the time, that's evolving. This E encompasses all the other letters, but also adds the element of time and new sensations. A mole that starts to feel different, that starts to stand out from its neighbors. That's the one to watch. It's your body signaling that something is happening beneath the surface. A shift that wasn't there before. The key message here is vigilance, not paranoia. Take a moment each month to simply look at your skin, especially areas exposed to the sun. If you spot a mole or a new spot that exhibits any of these ABCDE characteristics, or simply looks different from all your other moles, what doctors sometimes call the ugly duckling sign, then it's time to schedule a visit with your doctor or a dermatologist. Don't delay, because early detection truly is the best defense. This simple act of self-examination can be incredibly powerful. Now that we've discussed the importance of moles and their changes, let's move on to other, perhaps less obvious, silent signs that could appear on your skin. Moving beyond moles. Let's talk about the next silent sign that many people tend to ignore or mistake for something minor: any new growth on your skin that doesn't heal. This isn't just about a scrape or a cut that takes a while to mend. This refers to a persistent sore, a bump, or a red patch that simply won't go away, or keeps crusting, bleeding, or weeping. We're often quick to think, "Oh, it's just a zit," or "I must have scratched myself in my sleep." But if that spot remains for more than a few weeks, especially if it seems to be getting worse, not better, it demands your attention. This could be a sign of non-melanoma skin cancers, like basal cell carcinoma or squamous cell carcinoma, which are far more common than melanoma, though still serious if left untreated. Basal cell carcinoma, for instance, often presents as a pearly or waxy bump. It might look like a small, flesh-colored mole or a pimple that just doesn't resolve. Sometimes, it has a subtle indentation in the center, or it might appear as a flat, firm, pale or yellow area, similar to a scar. You might notice tiny blood vessels, almost like threads. On its surface, it can be found anywhere on your body, but it's most common on sun-exposed areas like your face, ears, neck, scalp, or hands. The crucial point here is its persistence. A pimple goes away, a scratch scabs over and heals, but this kind of bump or sore lingers. It might bleed easily when you gently rub it, then form a crust, only to bleed again. It's deceptively subtle, often painless, which is why it's so easy to ignore. Imagine a tiny, clear, almost translucent bump that you keep noticing every time you look in the mirror. and it just never quite disappears. That's a classic presentation. Then there's squamous cell carcinoma. This type often appears as a firm, red nodule, or a flat lesion with a scaly, crusty surface. It might look like a wart, or a persistent scaly patch that you thought was just dry skin, or even a sore that doesn't heal. These are also commonly found on sun-exposed areas. A good way to think about it is if you have a patch of skin that's consistently rough, scaly, or seems to be forming a crust that just peels off and reforms. Unlike dry skin, which usually responds to moisturizers, this kind of patch will persist and might even feel tender or bleed when scratched. It can grow into a larger, more pronounced tumor, sometimes resembling an open sore. You might think, "Oh, it's just eczema," or "I've had this dry patch forever." But if it's new, persistent, and has those rough or crusty characteristics, it's worth investigating. Some people describe it as feeling like sandpaper on their skin. The key distinction from regular dry skin is that it's often isolated to one specific spot and doesn't improve with typical moisturizing routines. Our next crucial silent sign involves any patch of skin that becomes persistently itchy, tender, or painful without a clear reason. We all get an itch now and then, perhaps from dry skin or an insect bite. But if a specific spot on your skin, whether it's a mole or just a patch of seemingly normal skin, starts to persistently itch, become tender to the touch, or even cause pain, and there's no obvious cause like an injury or rash, it's a red flag. These symptoms can indicate underlying changes in the skin cells. Think about it. Our bodies are pretty good at telling us when something is wrong. Pain and tenderness are warning signals. An itch that doesn't go away, even after applying cream or scratching, can be a symptom of various skin cancers, including melanoma and non-melanoma types. Imagine a mole that you've had for years, completely unremarkable, and suddenly it starts to itch constantly, or feel sensitive when your clothes rub against it, or a new patch of skin that just won't stop bothering you with an unusual sensation. These are changes in sensation, and they are just as important as changes in appearance. It's not just about what you see, but what you feel. This is particularly important because people often focus only on the visual aspects of a mole. But if your mole, or a spot on your skin, starts to feel noticeably different, tender, itchy, or painful, that's your body giving you an important cue. This often signifies that the growth is active and potentially invading deeper tissues or stimulating nerve endings. Don't dismiss persistent discomfort as merely an annoyance. It could be your body's subtle way of drawing your attention to a problem that needs addressing. So, to recap these last two important points, any sore or bump that doesn't heal, and any patch of skin that persistently itches, feels tender, or causes pain, are critical silent signs. They're often overlooked because they don't always fit the typical dark mole image of skin cancer. But they are just as, if not more, insidious because their very subtlety allows them to progress unnoticed. Don't hesitate to consult a healthcare professional if you experience any of these. Now that we've discussed these vital warning signs on the skin's surface, let's dive into a few more specific, yet often surprising, areas where skin cancer can manifest, and what that might mean for you. Now, let's explore some even more surprising, yet critically important, places where silent cancer signs can appear, areas we often neglect during our self-checks. The first is any dark streak or spot underneath a fingernail or toenail that isn't due to an injury. This might sound unusual, but melanoma can actually develop under the nails, a condition known as subungual melanoma. It often looks like a bruise or a fungal infection, which is why it's so commonly missed or misdiagnosed. However, unlike a bruise, which grows out with the nail or fades, a subungual melanoma streak typically doesn't grow out with the nail and often widens, darkening over time. It's usually a single, Dark, often brownish or black band that extends from the cuticle to the tip of the nail. Sometimes, the pigment might spread to the skin around the nail, a phenomenon called Hutchinson's sign. Imagine you accidentally hit your thumb with a hammer, and you get a bruise under the nail. That bruise will eventually grow out as your nail grows. But if you see a dark streak appear under a nail without any trauma, or if a bruise-like mark doesn't disappear over a few months, or if it changes in size or color, that's when you need to be concerned. It can be easy to dismiss this, especially on toenails, as just a fungal infection or a minor injury you've forgotten about. But the insidious nature of this type of melanoma is precisely why it's so vital to be aware. It is particularly concerning if it affects a single nail, especially the thumb or big toe, and has no clear explanation. Don't just paint over it or assume it's nothing. Peeling back that polish or taking a closer look at your bare nails could truly be life-saving. This is a form of melanoma that is less common but can be quite aggressive because of delayed diagnosis. Another often overlooked area where skin cancer can manifest is on the palms of your hands and the soles of your feet. These areas are not typically exposed to the sun, so we tend to think of them as safe zones. However, a type of melanoma called acral lentiginous melanoma can develop on these non-sun-exposed sites. This type of melanoma is more common in people with darker skin tones, but it can affect anyone. It often appears as a flat, dark brown or black patch with irregular borders and varied color, because these areas are less commonly checked, and because the lesions might resemble common moles, warts, or even calluses. They can go unnoticed until they are quite advanced. Think about how often you truly examine the soles of your feet or the palms of your hands. Probably not often enough. But if you notice a new, dark spot on your palm or sole, or a mole in these areas that starts to change, evolve, or look significantly different from your other moles, it warrants immediate attention. It might begin as a small, discolored patch and slowly enlarge, becoming darker and more irregular over time. It can also be found around or under the nails in these areas. Similar to what we discussed for subungual melanoma, the key is to specifically include these areas in your regular skin checks. Don't assume that just because an area isn't sun-exposed, it's immune to skin cancer. That's a dangerous misconception. Finally, let's address the persistent, tender, or painful red spots or lumps. Especially on sun-exposed skin, that might seem like nothing more than an irritated patch. While we touched on general persistent sores, it's important to specifically consider actinic keratoses AKs, which are precancerous growths that often feel like rough, scaly patches and are typically found on sun-damaged skin. These aren't skin cancer yet, but they can progress to squamous cell carcinoma if left untreated. They are often easier to feel than to see, like a patch of sandpaper on your skin. If you run your fingers over your scalp, face, ears, or the back of your hands and feel rough, dry, or crusty spots that don't go away, these could be AKs. Beyond AKs, any persistent red lump that is tender, bleeds easily, or doesn't resolve, especially if it's growing, should be evaluated. This can be a sign of aggressive squamous cell carcinoma or even other rare forms of skin cancer. Sometimes these lumps can be quite firm, even hard, and they might have a central ulceration. They might look like a regular lesion, but their persistence and symptoms, tenderness, pain, or bleeding, are what make them suspicious. This is your body telling you something is very wrong at that specific spot, and it needs professional eyes to assess it. So, we've walked through quite a bit, haven't we? From the familiar ABCDEs of moles to the less common but equally vital signs on nails, palms, soles, and those subtle rough patches. The core message here is one of awareness, not alarm. Remember, your skin is your body's largest organ, and it's constantly communicating with you. Pay attention to its language. Small changes can indeed make a big difference, not just in your general well-being, but in catching serious conditions early. The power of early detection cannot be overstated when it comes to skin cancer. It means simpler treatments, higher cure rates, and ultimately, more peace of mind. I really encourage you to make self-skin checks a regular part of your routine, maybe once a month. Stand in front of a mirror, use a handheld mirror for hard-to-see areas, and take a good look from head to toe. Don't forget your scalp, behind your ears, between your toes, and under your nails. If something looks or feels different, if a spot seems to be changing, growing, or developing new symptoms, don't hesitate. Trust your instincts. Pick up the phone and make an appointment with your doctor or a dermatologist. They are the experts who can properly evaluate any suspicious spots and provide you with reassurance or a clear path forward if treatment is needed. Don't put it off. Thinking it can wait. Your health is too important. Now, for that surprise I promised you at the beginning. You might think that avoiding the sun completely is the ultimate protection against skin cancer. And while sun protection is absolutely vital, here's the surprising truth: not all skin cancers are caused by sun exposure, as we discussed with melanoma on the palms and soles. And even some types of basal cell carcinoma can develop in areas not exposed to the sun. This underscores the critical importance of a full-body skin check, not just sun-exposed areas, and understanding that genetics, weakened immune systems, and other factors also play a role. So, while you should definitely be vigilant about sun protection, don't let it give you a false sense of security about other areas of your skin or the potential for non-sun-related skin cancers. The surprise is that full-body vigilance, regardless of sun exposure, is your most powerful tool. Thank you for watching and for investing in your health. If you found this information helpful, please consider giving this video a thumbs up. It really helps us reach more people who could benefit from this knowledge. And if you haven't already, subscribe to our channel for more practical health advice and tips to help you live your best life at every age. Share your thoughts or any experiences you've had in the comments below. Your insights could help someone else who is going through something similar. Remember, knowledge is power, and taking proactive steps for your health is the greatest gift you can give yourself. Live your best life at every age.